you bring up a really important point about the scans, that scans are not all that helpful in many patients with HR-positive disease. SERENA-6 looked at patients who were on their endocrine therapy for at least 6 months. So endocrine-sensitive disease, where we see bone lesions and it's so difficult to tell progression in bone for most patients who stay on treatment. So, how would that, you have the emergence of an ESR1 mutation. At San Antonio, we saw that switching resulted in this very rapid and quite good clearance of ESR1, whereas, of course, not switching didn't. Does that impact something about your understanding of disease burden?
Yeah, I would say that it's hard to know how to interpret that at the moment because we don't have a wealth of data to tell us the significance exactly of what it means that when we, sort of clear the mutation from the ctDNA, it's not the most promising, not the most prevalent mutation that is circulating at that time. But it certainly is really, really intriguing. And, I am starting to change my thinking specifically about the pain that you mentioned, because like you say, it's the idea of preventing additional bone lesions potentially is really, exciting because that does lead to some more disability and pain and decreased quality of life. Yeah, exactly. And, fractures. And so the idea of being able to prevent that, as opposed to what I've been taught in my whole career about waiting as long as possible, is entering my mind and starting to sort of percolate maybe my thinking about metastatic breast cancer. Maybe we're at a place that changing our paradigms is appropriate because our drugs are better and we have more of them. Things used to be so limited in what we had at all that the idea of just, even if there was a bit of progression, staying on because it wasn't clinically
Right, you would
significant.
just, little progression, wait,
Yeah.
and I think that's not lost because, 40% of ESR1 mutations, 60% will not. So we
Mhm.
still are taking that approach until we have more effective therapies there.